to adulthood and the family system. As future LPNs, it's important to understand that adulthood is not a single stage. It spans several decades and includes major developmental transitions. Our patients in this age range may be building families, advancing their careers, caring for aging parents, managing chronic illnesses, or dealing with life changes like marriage, divorce, or loss. Understanding these normal developmental patterns helps us provide care that's realistic, supportive, and sensitive to the challenges adults face. We will look at physical, emotional, and psychosocial changes that occur during adulthood and discuss how these changes influence health behaviors and family dynamics. We'll also talk about what a family means in modern healthcare. Remember, families can be biological, blended, adoptive, chosen, or multi-generational. As LPNs, we need to support each patient within the context of the family system that they identify. Throughout this chapter, think about how life stages, stressors, relationships, and responsibilities shape a person's health needs and their ability to follow a care plan. As we move into the topic of adulthood, the key idea I want you to remember is that adulthood is not a static period. It is a time of continuous change. Even though we often think of growth and development as something that only happens in childhood, adults continue to grow emotionally, mentally, socially, and physically throughout the entire lifespan. This is important in nursing because an adult patient's needs, coping skills, and responsibilities can vary greatly depending on their stage of adulthood. Adulthood generally begins at age 18, and for teaching purposes, we divide it into three major segments. Young adulthood from ages 18 to 35 is what Shea identifies as the achievement stage. During this time, adults focus on personal and career goals, choosing a profession, forming long-term relationships, and establishing independence. Next is middle adulthood, ages 35 to 65, which Shea calls the responsibility stage, and in some cases the executive substage. These adults are often managing careers, raising families, caring for aging parents, and making major life decisions. Finally, older adulthood, beginning at age 65, extends through the end of life. In this stage, individuals may shift their focus to health maintenance, retirement, life review, and adapting to physical changes or losses. As nurses, recognizing where a patient is developmentally allows us to better understand their priorities, stressors, and support systems. Shea's theory of cognitive development helps us understand how adult thinking changes across the lifespan. While children and teens focus on building basic knowledge, adults use thinking skills in more practical, purposeful ways. In the achievement stage, which occurs mainly in young adulthood, individuals need to apply what they've learned to reach goals. This is the stage of using education, training, and personal strengths to build a career, form relationships, and create a stable life. The focus is on learning how to succeed and gaining confidence in one's abilities. As adults move into middle adulthood, they enter the responsibility stage where thinking becomes centered on solving real-life problems. Adults in this stage are often responsible for themselves, their families, and sometimes aging parents. Their decision-making includes planning, organizing, and balancing multiple needs. They are less focused on personal achievement and more focused on making decisions that support the well-being of others. Some adults also move into the executive substage, especially those in leadership roles, either at work, at home, or within the community. In this substage, cognitive development involves the ability to manage complex situations, delegate tasks, juggle multiple roles, and think ahead. As nurses, recognizing which stage a patient is in helps us better understand their stressors, priorities, and the level of support they may need when making healthcare decisions. Erickson's theory helps us understand how adults form their identity, build relationships, and find meaning throughout the lifespan. In the young adult stage, the major psychosocial task is intimacy versus isolation. During this stage, adults are learning how to build close, committed relationships. They are figuring out whether they feel secure enough in themselves to share deeply with another person, emotionally, socially, and sometimes physically. When intimacy is achieved, individuals feel connected and supported. When it's not, they may experience loneliness, difficulty trusting others, or a sense of social isolation. As nurses, recognizing where a patient is on this spectrum can help us approach sensitive topics with empathy and respect. In middle adulthood, the main task becomes generativity versus stagnation. This stage focuses on contributing to the next generation and making a meaningful impact on the world. Adults who achieve generativity feel motivated to guide younger people, support their own children or grandchildren, and engage in community or mentoring roles. They often take pride in being helpful, productive, and responsible. On the other hand, stagnation occurs when adults feel disconnected, unproductive, or lacking a sense of purpose. Understanding this dynamic is important in nursing because a patient's sense of purpose, or lack of it, can significantly influence their mental health, coping behaviors, and motivation for self-care. When we talk about families in nursing, it's important to think beyond the traditional idea of a mother, father, and children. A family is any group of individuals who care about each other, support one another, and share a sense of belonging. Families can be biological, blended, adoptive, foster, same-sex, multi-generational, or chosen families made up of close friends. What matters most is the emotional connection and the role the family plays in providing support. Families create the first and most influential environment in which children learn basic values, communication skills, social behaviors, and how to relate to others. Through daily interactions, children develop trust, empathy, problem-solving skills, and expectations for how relationships should work. As nurses, we recognize that every patient's family background shapes their coping style, beliefs about health, and willingness to seek help. Even in adulthood, families remain important throughout the lifespan. Adults often rely on family for emotional support, help during illness, or assistance with childcare or elder care. Understanding a patient's family structure helps us identify support systems, plan realistic care, and respect the patient's cultural and personal preferences. A family-centered approach ensures we are caring not just for the patient, but for the entire support network that influences their health. When we look at the functions of the family, it becomes clear why families play such a powerful role in shaping health and development across the lifespan. Every family, regardless of structure, performs certain core functions that help members meet physical, emotional, and social needs. The first of these is physical maintenance, which includes providing the essentials of life, food, shelter, clothing, and medical care. This function forms the foundation for a person's overall well-being. Families also provide protection, meaning they create an environment where members feel safe physically and emotionally. This includes protecting children from harm and providing stability during stressful times. Nurturance goes hand in hand with this. Families offer love, affection, and guidance, helping individuals build emotional security and healthy coping skills. Another essential function is socialization. From early childhood, families teach us how to communicate, make friends, manage emotions, and follow social norms. Families also provide education not only through homework help or school readiness, but also by teaching values, cultural expectations, and everyday life skills. Reproduction is another biological function of families, helping to continue the species and support the growth of society. But families also play an important role in recreation, spending enjoyable time together, laughing, and building positive memories. Finally, families offer support. Whether it's emotional comfort, financial help, or assistance during illness, families help carry each other through life's challenges. In nursing, recognizing these functions helps us understand a patient's support system and identify areas where they may need extra resources. When we identify the types of families our patients come from, it helps us understand their support systems, their stressors, and the relationships that influence their health. Families can take many forms, and all of them can provide love, structure, and stability. The nuclear family includes one or two parents and their children living together. This is often seen as the traditional family model, but it is no longer the most common structure in many communities. An extended family includes not just parents and children, but also grandparents, aunts, uncles, cousins, or other relatives who live together or play significant roles in day-to-day life. This type of family may offer strong support systems and shared responsibilities. A step-family forms when one parent with children marries a new partner, creating a family structure that blends relationships across biological and marital lines. A single-parent family involves one adult, either a woman or a man, raising children alone. This may occur because of divorce, death, separation, military deployment, incarceration, or personal choice. These families can face unique challenges related to time, finances, and caregiver stress, and as nurses, we should be sensitive to these potential burdens. A blended family is formed when a couple comes together, bringing children from previous relationships into one household. These families may work through complex dynamics, new routines, different parenting styles, and adjusting to shared roles. Understanding these diverse structures helps us provide culturally competent, non judgmental care, and it reminds us that all family types can be strong, supportive, and healthy environments for children and adults. As we continue looking at the different types of families, it's important to remember that modern family structures are diverse, and each type can provide a loving and stable environment. Cohabitation refers to couples who live together without being legally married. They may or may not have children, but they share daily responsibilities and provide care and support for one another, much like a married couple. This is increasingly common, and nurses should avoid assumptions about marital status when assessing family roles. The term partner family typically refers to families in which the parents are of the same gender. Their children may come from previous relationships, donor insemination, surrogacy, or adoption. These families are just as nurturing and capable as any other, and it's important for nursing care to be inclusive, respectful, and aware of any unique social or legal challenges they may face. Foster families involve temporary caregivers who provide for a child's physical and emotional needs when the child cannot safely live with their biological parents. Foster care may last weeks or years, and foster parents often work closely with social services to support the child's well-being until reunification or adoption. Nurses caring for foster children must be aware of confidentiality rules, trauma histories, and legal guardianship limits. Finally, adoptive families are those in which caregivers obtain legal guardianship of a child, giving them full parental rights. Adoptive families may be formed through domestic adoption, international adoption, kinship adoption, or foster to adopt programs. Each of these family types is equally valid and important, and understanding them helps nurses provide respectful, family-centered care tailored to each patient's support system. When we look at families today compared with several decades ago, we can see how social and economic changes have reshaped family life. Urbanization is one of the biggest historical shifts. In the past, many families lived in rural areas, worked on farms, and relied on one another for food, childcare, and daily survival. These families were typically self-sufficient and lived close to extended relatives. Today, only a small percentage of the population lives on farms, and most families depend on outside systems such as schools, workplaces, and community agencies for support. This shift has changed not only how families function, but also how they access healthcare. Another major change is mobility. Families now move more frequently in response to job opportunities, economic pressures, or housing availability. Because of this, children may attend several different schools and may not grow up near grandparents or extended family. High mobility can strengthen independence but may also create challenges, such as reduced social support and increased stress during transitions. As nurses, understanding a family's mobility history can help us recognize stressors related to relocation or lack of nearby support networks. Finally, family size has decreased over time. Families are having fewer children due to rising costs of living, increased access to contraception, career priorities, and delayed childbearing. Smaller families may have more financial stability, but they may also have fewer relatives available to share caregiving responsibilities. For healthcare providers, recognizing these historical trends helps us better understand patient backgrounds, available resources, and the social factors that influence health and family functioning. When we look at families today compared with several decades ago, we can see how social and economic changes have reshaped family life. Urbanization is one of the biggest historical shifts. In the past, many families lived in rural areas, worked on farms, and relied on one another for food, childcare, and daily survival. These families were typically self-sufficient and lived close to extended relatives. Today, only a small percentage of the population lives on farms, and most families depend on outside systems such as schools, workplaces, and community agencies for support. This shift has changed not only how families function, but also how they access healthcare. Another major change is mobility. Families now move more frequently in response to job opportunities, economic pressures, or housing availability. Because of this, children may attend several different schools and may not grow up near grandparents or extended family. High mobility can strengthen independence but may also create challenges, such as reduced social support and increased stress during transitions. As nurses, understanding a family's mobility history can help us recognize stressors related to relocation or lack of nearby support networks. Finally, family size has decreased over time. Families are having fewer children due to rising costs of living, increased access to contraception, career priorities, and delayed childbearing. Smaller families may have more financial stability, but they may also have fewer relatives available to share caregiving responsibilities. For healthcare providers, recognizing these historical trends helps us better understand patient backgrounds, available resources, and the social factors that influence health and family functioning. Divorce is a major life event that can create emotional, social, and financial stress for families. And as nurses, we need to understand how it affects everyone involved. Many marriages today do end in divorce, and while the exact percentage varies depending on the source, it remains a common experience across all age groups and backgrounds. This means LPNs will frequently care for adults and children going through or recovering from the effects of divorce. When divorce happens early in a marriage and before children are born, the emotional and logistical impact is usually less complicated. There are fewer long-term ties between the partners, and the separation tends to involve fewer negotiations and adjustments. However, when children are involved, the situation becomes more complex. Children may feel confused, frightened, or uncertain about their future. Many children, especially younger ones, mistakenly believe they caused the breakup or could have prevented it. This can lead to guilt, sadness, behavioral changes, or difficulty concentrating in school. Divorce affects more than just the parents and children. Extended family members, grandparents, aunts, uncles may also experience loss, shifting relationships, and reduced contact with the children. Nurses should be aware that families navigating divorce may demonstrate increased levels of stress, anxiety, or conflict. Understanding these emotional dynamics helps us respond with empathy, provide appropriate education, and connect families with supportive resources when needed. Family-centered care means recognizing that a major relational change like divorce influences the whole support system, not just the individuals directly involved. Discussing risk factors for divorce, it's important to approach this topic with sensitivity and without judgment. These factors do not guarantee that a marriage will end. They simply increase the likelihood based on research trends across large populations. Many individuals with one or more of these risk factors still have stable, fulfilling, lifelong marriages. As nurses, the goal is not to label families, but to understand stressors that may impact their emotional well-being. One significant risk factor is marrying very young, especially before age 20. Younger couples may have fewer coping skills, less financial stability, and less life experience, which can contribute to stress and conflict. Lower economic circumstances also place strain on relationships due to financial pressure, housing instability, or work-related stress. Some studies show that cohabitation before marriage, especially when done at a very young age or without a long-term commitment, may be associated with an increased divorce rate. Premarital pregnancy can add emotional and financial stress as well. When partners bring children from previous relationships, complexities such as blended family dynamics, parenting conflicts, or differing expectations may arise. A previous divorce can also increase the risk of a future divorce, often due to unresolved patterns or stressors. Couples who have known each other for only a short time may have less opportunity to identify long-term compatibility. Lower education levels, such as not finishing high school, are linked to lower income and higher stress, which can affect relationship stability. Finally, research indicates that couples with no religious affiliation or partners from very different faith backgrounds may face unique challenges related to values, traditions, or family expectations. Individuals who grew up with divorced parents sometimes have increased risk due to modeled patterns of conflict or instability, although many intentionally break those patterns. Understanding these risk factors helps nurses provide empathetic, informed care to patients navigating relationship stress. When we talk about young adulthood, we're focusing on a stage marked by rapid change, exploration, and increasing responsibility. Millennials, those born roughly between 1981 and 1996, now outnumber the baby boomer generation and represent more than a quarter of the U.S. population. This matters in healthcare because millennials make up a large portion of the workforce, are often raising young families, and are beginning to care for aging parents. Understanding their experiences helps us anticipate their health needs, stressors, and priorities. The decade following high school is a major transition period. During this time, young adults are exploring education, careers, relationships, and personal identity. They often face challenges related to managing finances, finding stable employment, and balancing independence with connections to family. Achieving economic independence is one of the major milestones of this stage, though many young adults face significant barriers such as student loan debt, housing costs, or unstable job markets. Another key developmental task is learning to make independent decisions, from choosing a career path to developing long-term relationships. During these years, young adults are also forming a personal philosophy of life, shaping their belief system, clarifying their values, and developing a sense of personal ethics. These changes influence everything from health behaviors to communication styles and stress management. For nurses, understanding young adult development helps us build rapport, support healthy coping skills, and provide patient education that respects their growing independence and evolving identity. When we talk about maturity in young adults, we're really referring to the emotional and behavioral skills that help a person function successfully in adult life. Maturity isn't about age, it's about how consistently a person handles responsibilities, emotions, and relationships. One of the first indicators of maturity is the ability to acknowledge and express feelings appropriately. This means being honest about emotions, but also being able to express them with restraint, without harming yourself or others. Another sign of maturity is the ability to laugh at yourself. People who take themselves too seriously often struggle with stress and conflict, while those who can recognize their own imperfections tend to be more adaptable and resilient. Mature adults also accept responsibility for their actions, both good and bad. They don't blame others when things go wrong, and they learn from experiences instead of repeating the same mistakes. Mature individuals can tolerate frustration. They understand that life doesn't always go as planned. They are also able to accept diversity and individuality in others, recognizing that different experiences and perspectives enrich relationships and communities. They know how to trust appropriately, balancing healthy boundaries with meaningful connection. Other indicators include self-confidence, which helps adults advocate for themselves and solve problems independently, healthy coping skills to manage stress, and the ability to self-discipline, whether managing time, finances, or personal habits. Finally, mature adults can handle problems without losing sight of their long-term goals. They stay focused even when facing setbacks. As nurses, understanding these traits helps us support patients who may be struggling with emotional development, stress, or life transitions. In young adulthood, the body reaches its highest level of physical functioning. Strength, endurance, and overall energy are typically at their peak, meaning young adults can perform physically demanding tasks with ease. This peak performance includes the cardiovascular, respiratory, and musculoskeletal systems working at optimal efficiency, which is why young adulthood is often considered the time of greatest physical capability. By this stage, skeletal development is complete, including the full hardening of bones. Dental maturity is also complete, meaning all permanent teeth have erupted, and wisdom teeth, if present, have either erupted or been removed. During the 20s, both physical growth and brain development reach full maturity. Although the brain continues refining decision-making and impulse control into the mid-20s, most structural development has finished. Biologically, the most fertile reproductive years fall between ages 19 and 26, when hormone levels, egg quality, and sperm quality are at their strongest. However, it is important to remember that individuals can and do reproduce safely outside this range with appropriate healthcare support. Another developmental task in young adulthood is identifying sexual orientation, sexual preferences, and relationship patterns. This refers to a person understanding their attraction patterns, comfort levels, and personal boundaries, not just identifying their partner preference. As nurses, it's important to use inclusive language and support patients' autonomy and privacy, while also respecting cultural and personal values. When we look at health concerns in young adults, we see that many of the issues in this age group are influenced by lifestyle, stress, and environmental factors. Risk-taking behaviors are especially common in young adulthood, sometimes because individuals feel healthy and invincible, and sometimes because of peer influence, stress, or lack of health education. These risky behaviors may include chemical abuse, overeating, inadequate sleep, inactivity, and unprotected or high-risk sexual behaviors. As nurses, our role is to provide non-judgmental education, promote harm reduction strategies, and help young adults develop healthier coping skills. Young adults also face significant risks related to unintentional injuries. especially motor vehicle crashes. National data consistently show that motor vehicle accidents remain one of the leading causes of death among young adults across racial groups. Homicide is also a major cause of death, and rates vary depending on community factors, socioeconomic conditions, and access to resources. When discussing these statistics, it's important to frame them in terms of social determinants of health, not personal blame. Violence, injury risk, and safety behaviors are shaped by community resources, social support, education, and public policy. Another major health issue in young adulthood is stress-related illness. This is a time of intense pressure, balancing work, school, finances, relationships, and sometimes caregiving responsibilities. Chronic stress can contribute to headaches, gastrointestinal problems such as gastric ulcers or irritable bowel symptoms, and long-term conditions like hypertension. Stress regulation skills often determine how well a young adult maintains physical and mental health. As nurses, we can support this age group by promoting adequate sleep, exercise, balanced nutrition, relaxation strategies, and referral to mental health resources when needed. As we continue discussing health concerns in young adults, one thing we emphasize in nursing is that chronic diseases don't wait until middle age. Many conditions, including certain cancers, can begin developing silently during young adulthood. That's why early education, preventive care, and routine health screenings are so important. For young adult women, breast health awareness begins in the 20s and 30s. Although routine mammograms don't typically start until later, women should still have clinical breast examinations as part of their regular health visits, and they should be taught breast self-awareness, meaning they know what is normal for their bodies and can report any changes promptly. When it comes to cervical cancer screening, women should receive regular pap smears beginning at age 21, following the recommended schedule from their provider. This early screening is crucial because cervical cancer is highly preventable when precancerous changes are detected early. Young men should also be taught about early detection. Many providers encourage testicular self-examination starting in the teen years because testicular cancer is one of the most common cancers in males ages 15 to 35. Early identification of lumps or changes can dramatically improve outcomes. Across all young adults, annual physical examinations are strongly encouraged. These visits offer opportunities to address mental health, stress, sleep habits, weight changes, substance use, reproductive health, vaccinations, and family history risks. Young adulthood is the ideal time for prevention because habits formed now often shape long-term health outcomes. As nurses, our role is to teach, encourage, and empower young adults to take charge of their health while they are still feeling strong and well. In young adulthood, cognitive abilities continue to mature and become more practical and focused. During this stage, individuals begin applying intelligence and knowledge in meaningful ways, whether in higher education, job training, or building a long-term career. This is the period when abstract thinking becomes connected to real-world goals, such as planning for financial independence, choosing a career path, or navigating complex relationships. Young adults also become more skilled at reasoning, problem-solving, and setting realistic goals. Their thinking becomes more flexible, allowing them to consider multiple solutions to a problem and weigh long-term consequences. This growth helps them handle responsibilities such as budgeting, managing schedules, or making critical decisions about work and family. They also become better at evaluating risks and benefits, which is a major shift from the impulsivity often seen in adolescence. Cognitive development during this stage is strongly influenced by supportive relationships, partners, family members, mentors, professors, or workplace supervisors. These people help young adults refine their thinking, build confidence, and learn how to approach challenges constructively. Social support also encourages persistence, motivation, and resilience when faced with setbacks. As nurses, understanding this cognitive stage helps us tailor our teaching, making sure information is practical, relevant, and respectful of the patient's growing independence and decision-making abilities. Psychosocial development in young adulthood centers around identity, relationships, and the transition into full adult roles. One of the major milestones in this stage is gaining independence from parents. Young adults begin managing their own housing, education, finances, and social responsibilities. However, this transition isn't always a straight line. Some young adults become what we call boomerang children, individuals who move back in with their parents after living independently. This is often due to financial stress, job changes, school transitions, or the end of a relationship. Returning home doesn't reflect failure. It reflects the complex economic and social challenges facing this generation. Erickson describes the psychosocial task of young adulthood as intimacy versus isolation. During this period, individuals seek meaningful, committed relationships. Achieving intimacy means forming deep emotional connections, learning to trust others, and being willing to share life experiences. When intimacy is difficult, isolation may result, leading to loneliness, fear of commitment, or difficulty forming stable relationships. As nurses, understanding this dynamic helps us support patients navigating relationship challenges or emotional stress. Another important aspect of this stage is that personality continues to evolve. Although core traits remain stable, young adults refine their sense of self through work, friendships, romantic partnerships, and personal experiences. They develop stronger values, coping skills, emotional maturity, and a clearer picture of who they are and what they want. This is a time of self-discovery and growth, shaped by both independence and interpersonal connection. In young adulthood, individuals face important developmental tasks that shape their identity, lifestyle, and long-term well-being. One major task is deciding whether or not to marry. For some young adults, marriage represents stability, companionship, and shared goals. For others, it raises questions about timing, financial readiness, or long-term compatibility. The decision to marry is deeply personal and influenced by cultural values, family expectations, career plans, and individual relationship history. Healthy marriages depend on mutual respect, communication, sharing, and commitment. These qualities don't appear automatically. Young adults often spend time learning how to negotiate differences, manage conflict, and build trust. Many people today choose to cohabit, live together before marriage, either to test compatibility or because they are uncertain about making a long-term commitment. Cohabiting doesn't mean a relationship is weak. It often reflects financial considerations, cultural norms, or the desire to make thoughtful, informed choices about long-term partnership. On the other hand, many young adults remain single, either temporarily or by choice. Single adulthood can offer significant independence. Young adults manage their own time, money, and decisions without needing to compromise with a partner. This can support personal growth, career development, and self-discovery. However, some single adults report feelings of loneliness, especially if they lack strong social support or if peers are pairing off or starting families. As nurses, understanding these different relationship paths helps us provide non-judgmental, patient-centered care that respects each individual's values, goals, and life circumstances. In young adulthood, people take on a wide range of developmental tasks that help shape their adult identity and sense of responsibility. Parenting is one of the most significant transitions during this stage. Many individuals become parents in their 20s and 30s, while others choose to delay childbearing to focus on education, career development, or financial stability. It's important to remember that giving birth is only the beginning of parenting. The real work involves years of decision-making around childcare, discipline, education, safety, and emotional support. Tasks such as arranging daycare, managing school schedules, helping children develop social skills, and supporting their growing independence continue throughout young and middle adulthood. Another major developmental task is home management. Young adults learn how to keep daily life running smoothly. Everything from budgeting, paying bills, buying groceries, cooking meals, maintaining a household, and dividing responsibilities with partners or roommates. These skills may seem small, but they are essential for long-term stability and independence. Young adults are also working on developing a social group. Friendships beyond the immediate family often become especially important during this stage. These relationships provide emotional support, reduce stress, and help individuals feel connected. Maintaining friendships while juggling work and family demands can be challenging, but these social networks play a key role in mental health and life satisfaction. Finally, young adults begin taking on community responsibility. This means reaching beyond their own needs and showing concern for others, whether through volunteering, participating in community groups, supporting local activities, or advocating for causes that matter to them. This outward focus strengthens leadership skills, reinforces personal values, and helps build healthier, more connected communities. As nurses, understanding these developmental tasks helps us support patients as they balance parenting, careers, relationships, and community involvement. When we talk about middle adulthood, we're referring to adults roughly between the ages of 46 and 64. This is often described as one of the most fulfilling stages of life because people tend to feel more stable, more confident, and more established than they did in young adulthood. Many individuals in this age range have solid careers, strong family relationships, and a clear understanding of their personal values and goals. They are frequently seen as leaders, both within their workplaces and within their families, often guiding younger adults or taking on mentorship roles. Middle adulthood is also a time of continued social and personal growth. People may expand their social networks, become more involved in their communities, or explore new hobbies and interests. Emotionally, many adults experience greater self-acceptance and wisdom gained from life experience. However, it's also common for people in this age group to be reluctant to identify themselves as middle-aged. This can be due to societal pressure to remain youthful or because people feel younger than the number on their birth certificate. As nurses, it's helpful to understand this reluctance so that we can communicate respectfully and support positive aging attitudes. Overall, middle adulthood is a time of productivity, strength, and continued development. In middle adulthood, physical changes gradually become more noticeable, and many individuals begin actively looking for ways to slow the aging process. Weight redistribution is one of the earliest and most common changes. Men often experience increased fat around the waist, while women may notice more weight settling around the hips and thighs. Even with consistent diet and exercise, the body's metabolism naturally slows during this stage, making weight gain easier and weight loss more difficult. Another significant change is the development of presbyopia, an age-related decrease in the ability to focus on close objects, which often leads to the need for reading glasses. Many adults also experience presbycusis, a gradual decline in hearing, especially difficulty hearing higher-pitched sounds. These sensory changes can affect daily functioning, communication, and safety. For women, menopause typically occurs during these years, bringing hormonal changes that may cause hot flashes, mood shifts, sleep disturbances, and a decrease in libido. Men may also experience a gradual decrease in libido, often related to hormonal shifts, stress, or chronic health conditions. Cosmetic changes also become more visible. Graying hair and thinning skin are normal signs of aging related to decreased melanin production and changes in collagen and elastin. Many adults at this stage seek ways to maintain a youthful appearance, such as changes in diet, exercise routines, skincare habits, or cosmetic procedures. As nurses, it's important for us to approach these changes with sensitivity and understanding, helping patients focus on healthy aging rather than unrealistic expectations. In middle adulthood, a person's overall health is strongly influenced by the lifestyle habits they've practiced over the years. Individuals who consistently take care of themselves through a balanced diet, regular exercise, stress management, and routine medical care are generally much healthier than those who do not. This is the stage of life when long-term habits start showing more obvious effects, both positive and negative. Because the risk of chronic disease increases during the 40s, 50s, and 60s, regular health screenings become absolutely essential. Middle-aged adults should be screened for diabetes, heart disease, high cholesterol, hypertension, and colon cancer at recommended intervals. These screenings allow for early detection, which can significantly improve outcomes. The leading causes of death in this age group include heart disease, cancer, chronic lower respiratory diseases such as COPD, accidental injuries, and stroke. These conditions are closely linked to lifestyle factors, genetics, and long-term exposure to risks such as smoking, high stress, poor diet, and environmental hazards. In addition to mortality concerns, there are several major health problems that commonly emerge in middle adulthood. These include accidents, alcohol abuse, obesity, diabetes, hypertension, heart disease, and mental illness such as depression and anxiety. Many adults in this age group juggle multiple responsibilities: careers, parenting, aging parents, which can increase stress and contribute to health problems if self-care is neglected. As nurses, it's important to encourage our middle-aged patients to prioritize preventive care, adopt healthier habits, and seek help early when symptoms arise. This is a critical window for preventing serious health complications later in life. In middle adulthood, most people continue to function at a high cognitive level, but they may start noticing subtle changes in how quickly they process information or recall details. Sometimes, early signs of illnesses, such as thyroid disorders, depression, chronic stress, or sleep problems, can create the impression of mental decline when the real issue is actually a reversible medical condition. That's why it's important not to assume that forgetfulness or slowed thinking is just aging. One of the most important protective factors for cognitive health is staying mentally active. People who continue to use their intellect through reading, problem solving, pursuing hobbies, learning new skills, or staying socially engaged tend to remain curious, alert, and interested in life. This mental stimulation helps maintain neural pathways and supports long-term brain health. However, it's also normal for middle-aged adults to notice that they may need to work a little harder at remembering things. This might look like needing more reminders, writing notes, or double-checking schedules. These changes are usually mild and related to normal aging, busy lifestyles, and increased responsibilities, not major cognitive decline. As nurses, it's essential to educate patients about the difference between normal age-related changes and concerning warning signs that warrant further evaluation, such as memory loss that interferes with daily functioning. In middle adulthood, work life plays a major role in overall satisfaction and personal identity. Many people in this stage feel a strong sense of pride and fulfillment in their careers because they've spent years building skills, gaining experience, and contributing meaningfully to their workplaces. This sense of work satisfaction is closely connected to cognitive development. Adults in this age range often feel confident in their abilities to solve problems, mentor others, and make complex decisions. By middle adulthood, many individuals have also achieved increased income and greater responsibility, which can contribute to feeling more stable and successful. These factors often explain why many people describe this stage as some of their most productive and rewarding years professionally. At the same time, it's not unusual for adults to make a conscious decision to change careers during midlife. This might be due to burnout, a desire for new challenges, job dissatisfaction, or a shift in personal values. When these changes are voluntary, adults often adjust well and may even feel energized by pursuing a new path. However, middle-aged adults who are forced to make career changes, such as those caused by layoffs, health issues, or company restructuring, tend to face greater stress and may struggle with the transition. These situations can affect a person's self-esteem, sense of identity, and financial security. As nurses, it's important for us to recognize the emotional and psychological impact that career instability can have on our patients during this stage of life, and to support holistic coping strategies. One major theme of adulthood, especially middle adulthood, is the idea of lifelong learning. Many adults decide to return to school or pursue additional training, and they often find the experience both rewarding and challenging. Unlike traditional college-age students, adult learners bring years of life experience, responsibilities, and maturity to their education, which often enhances their motivation and success. For some adults, continuing education fulfills a lifelong personal goal that they may not have been able to pursue earlier in life. Others return to school because they need a degree or certification to keep their current job, stay competitive in the workforce, or meet new employer requirements. Education can also be a major stepping stone for individuals preparing for a career change, especially in a job market where skills and technology evolve rapidly. Women who previously stepped out of the workforce to raise a family often re-enter the job market during middle adulthood. Many of them return to school to refresh their skills or train for a completely new career path. This can be an empowering transition, offering independence, financial stability, and a sense of accomplishment. As nurses, understanding the pressures and motivations behind lifelong learning helps us support our adult patients, and it reminds us of the importance of staying current in our own profession. Lifelong learning is a key part of growth, resilience, and adapting to an ever-changing world. In middle adulthood, many individuals experience significant changes in their marriage and family relationships. As children grow up and leave home, some couples find that their relationship actually improves. Without the demands of daily child rearing, they may rediscover shared interests, reconnect emotionally, and enjoy more freedom and independence together. However, for couples who have been unhappy for many years, the children leaving home can remove the final barrier that kept them together, leading some to separate or divorce during this stage. Middle adulthood also brings changing roles and responsibilities, which can create new stress in a marriage or intensify existing problems. Adults might be caring for aging parents, managing demanding careers, supporting children through college, or navigating their own health issues. These pressures can challenge communication, intimacy, and emotional connection within the marriage. Another major psychosocial issue is empty nest syndrome. When children move out, parents may experience deep feelings of loss, sadness, or uncertainty, particularly if they have spent much of their identity and energy focused on raising their children. This transition can feel like a major life shift, and it may take time for individuals to establish new routines and redefine their sense of purpose. As nurses, it's important to recognize how these psychosocial stressors affect mental and emotional well-being so we can support our patients through middle life transitions. In middle adulthood, many parents begin to experience a new sense of pride and fulfillment as they see their children grow into responsible, independent young adults. This stage can bring a deep sense of satisfaction because parents can reflect on the years of effort, guidance, and support they invested, and now see the results in their children's achievements, maturity, and decision-making skills. Another major change during this time is the arrival of grandchildren, which adds an entirely new dimension to the family structure. For many middle-aged adults, becoming a grandparent is a joyful and meaningful experience. It allows them to build loving bonds with a new generation while also watching their own children step into the parenting role. Grandchildren often bring renewed energy, fun, and a sense of purpose into the lives of middle-aged adults. Most grandparents enjoy being actively included in the younger family's life, whether that means babysitting, attending school events, or simply spending quality time together. This involvement can create strong intergenerational connections and provide emotional support for the entire family. However, it's also important to remember that expectations should be balanced. Some grandparents may want to help as much as possible, while others may need to protect their time, work commitments, or health. As nurses, we should be mindful of the emotional, social, and caregiving roles that many middle-aged adults play within extended families. In middle adulthood, many people find themselves part of what we call the sandwich generation, because this means they're caring for their own dependent children, often teenagers or young adults still living at home, while also supporting aging parents who may need increasing levels of help with daily activities, medical care, transportation, or emotional support. Being pulled in two directions can create significant stress, especially when combined with work responsibilities and financial pressures. Adult children and their spouses frequently become the primary caregivers for elderly parents. This caregiving may begin gradually, helping with errands, coordinating appointments, or managing medications. Or it may come suddenly following a health crisis such as a fall, stroke, or hospitalization. Although many people feel honored to support their parents, caregiving can also lead to caregiver fatigue, guilt, and burnout. It's important for nurses to assess the well-being of caregivers, not just the older adult receiving care. Thankfully, many communities offer valuable support services to help reduce caregiver burden. These can include adult day programs, senior centers, respite care, home health services, meal delivery programs, transportation assistance, and caregiver support groups. Encouraging families to use these resources helps preserve their health, maintain balance, and prevent caregiver burnout. Understanding the emotional and practical challenges of the sandwich generation allows us, as nurses, to provide realistic guidance and compassionate support. In middle adulthood, one of the most important psychosocial tasks is what Erickson calls generativity versus stagnation. Generativity means feeling a sense of responsibility for guiding the next generation and making a meaningful contribution to society. At this stage, many adults naturally feel drawn to caring for others, sharing what they've learned, and leaving a positive impact, whether that's through raising children, volunteering, leading community programs, mentoring younger coworkers, or taking on leadership roles in religious or civic organizations. When adults experience generativity, they feel useful, productive, and connected. Many choose to become mentors, acting as teachers, coaches, or guides for younger adults who are still finding their path. This mentoring role can be incredibly rewarding and reinforces the sense that their experience has genuine value. On the other hand, stagnation occurs when adults feel disconnected, unproductive, or self-focused. Sometimes life experiences, stress, or lack of opportunity can make a person feel stuck or unsure of their purpose. A key developmental shift in this stage is accepting that life is complex, unpredictable, and often out of one's total control. Middle adults who achieve generativity tend to embrace flexibility, resilience, and the understanding that contributing to others brings meaning and satisfaction. As nurses, recognizing where a patient falls on this spectrum helps us better understand their emotional needs and sources of motivation. Answer 4. Rationale. Having parents married is not a risk factor for divorce. Being younger than 20, premarital pregnancy, and not finishing high school all increase the chance of divorce. Answer number 4. Focusing on taking care of aging parents occurs in late adulthood. Career exploration, marrying, and establishing a family, as well as establishing healthy habits, are important to the young adult. Answer 4. Rationale. Turning in a resignation does not demonstrate the ability to cope with stress. Accepting responsibility, expressing regret and remorse, and developing a daily schedule are behaviors that indicate maturity. Answer 3. Rationale. Middle adults often become involved in caring for their elderly parents or becoming mentors. Menopause occurs during this time, and middle adults often have greater responsibility. They also accept that life is not simple and that they cannot control it. Answer 2. Rationale. Suicide is not among the leading causes of death in middle adults. In middle adults, heart disease, vascular disease, cancer, and accidents are the leading causes of death.